Margaret, tell us about you, why you're at Wonka, and what are you passionate about?
Thank you, Gerrit. I'm Margaret. I'm a GP and I practice in the far east of the UK, which is called Hull. And I'm also the Vice Chair for Professional Development and Standards for the Royal College of General Practice. So I'm really excited to be here at Wonka, primarily because you get to network and meet like-minded individuals, which is great. This morning's plenary from Chris Butler was just inspiring because one of the passions I have is delivering research in primary care. So delivering research studies to particularly populations that are deprived, that don't often engage with our healthcare leaders. And COVID was one of the main drivers for me to get involved because people from my own community really had a lack of trust in society in itself. And what happened was phenomenal. Whilst COVID was tragic in terms of the loss of life, what happened was the engagement with our healthcare providers and communities was profound and has really changed the narrative. We're starting to build trust with our communities again, and we've just launched a new Centre for Research Equity at Oxford, and the hope is that will drive the need for us to tackle health inequalities in our societies. So that's my biggest passion, and that's really why I'm here.
That's really interesting because that was also the take-home message for me from the first interview, that the connection has, the interpersonal connection and network has actually gotten stronger during COVID. That's the same thing that you experienced?
It is, because we were told previously, and we bought into it, that certain communities are hard to reach, and that's not true. They're hardly reached, and now we're much more braver and bolder, going to where
and
people
making
are.
an effort,
Absolutely.
right?
So whether it's in the supermarkets or barbershops or churches, that level of engagement now is something that I have never really witnessed in my years as a general practitioner.
Talking about making an effort, we met in the gender equality session, which
Yes.
was really interesting and inspiring. What's your take-home message for that topic?
For women in general practice, I mean, we could be here all day, right? But the key message for me is just be inclusive, get everyone involved. It's not just a woman problem, it's everybody's problem. And we know that when we support each other in specific groups, we will all thrive.
That's wonderful. One love.
Yeah.